Hello, I'm Richard Stewart. Welcome to Cleveland Health on TV 20. This is the show where we tackle the health issues that matter most to our neighborhoods. Each week, we bring you powerful stories, expert insights, and real resources to help you and your family live healthier, stronger lives. Thank you for tuning in. Let's dive into what's shaping the health of Cleveland today and try to make a difference together. Today we're highlighting several key topics impacting our Cleveland community. In recognition of Minority Health Awareness Month, we spoke with Dr. Randy Vince about men's minority health, and we also stopped by the Murtis Taylor Center for their inspiring Thriving Together event. And later in the show, we'll explore the importance of National Healthy Homes Month and also spotlight the Clean and CLE initiative by the Cleveland Department of Public Health. But first, we're joined by the director of the Cleveland Department of Public Health, who is David Margolius. Dr. Margolius, thanks for joining us.
Thanks for having me.
Let's talk public health in Cleveland. What are some of the key issues that are impacting Clevelanders right now, and how is the health department helping to address them?
Yeah, thanks, Richard. Above all, it's about quality of life and life expectancy. In the city of Cleveland, our life expectancy is 20 to 30 years shorter than life expectancy in the suburbs. And so some of the things that we're focused on: smoking, lead poisoning, black infant mortality, and many more.
How does the Department of Public Health ensure that this education and the information is actually getting out to residents?
Yeah, so we, when I joined the department, I think we had just a couple health outreach specialists, folks whose full-time job was to be out in the community. Now we're up to 8, and we've got a few in every division and growing. We also have 2 mobile units that we're out in the community with, and we're just spending a lot of time outside of the office with folks in the community to help make the healthy choice the easy choice.
So in today's information age, we all have to deal with misinformation and disinformation from time to time. How do you dispel some of those myths from getting into the bloodstream of the public when they come out?
Yeah, I think above all, it's about trust. And so as a government entity, it's not necessarily the natural thing to trust us, the Cleveland Department of Public Health. But we've worked really hard to earn back or earn the trust of the community. We are striving to be the most responsive, most trusted, most impactful health department in the country. And through trust, we'll be able to help stop the spread of misinformation.
Along those same lines, what are some of the more impactful campaigns that have been done recently, and what's the impact that they've actually had on the ground?
Yeah, Richard, I'm so proud of the work that we've done together with a large number of folks from our team, with the American Heart Association, with the Campaign for Tobacco-Free Kids, with the Northeast Ohio Black Health Coalition on smoking. So our most recent smoking statistic was that 35% of adults in the city of Cleveland smoke cigarettes. We've been everywhere out in the community working to help people quit and educate folks on the history of why Cleveland's smoking rate was so high through really what tobacco executives were doing through racial targeting black smokers in Cleveland. I am proud to report that our smoking rate across the city of Cleveland, which we just redid over the last couple months with a very extensive survey, which you've covered, our new smoking rate is 19.6%, down from 35%. So that is lives saved, lives extended, and people breathing easier in Cleveland.
So talk about the new proposed legislation in the city of Cleveland as it relates to smoking in vape shops.
Yes, so unfortunately over the last 5 years, and especially in the last year and a half or so since issue 2 legalizing marijuana was passed, there has been a proliferation of smoke shops. Despite what people might think, there were no inspections happening in these smoke shops because the framework didn't exist for us to be able to do that. Thanks to City Council, we now have laws on the books that allow us to begin health inspections in smoke shops, and that will allow us to hold them accountable, and honestly, some of them will likely close down as a result of this legislation so that there are fewer and fewer smoke shops kind of infiltrating our community, and people have an easier time quitting smoking.
Sounds like a big deal.
It's something we've been working on for a very long time. Some folks have been working on this since 2015 here in Cleveland. I've been working on it since 2022. Just so excited that the legislation is now passed, and now the hard work begins of setting up the framework so that we can get in there and start enforcing.
What advice would you give to local residents on how they can create healthier communities right where they live?
Yeah, I think, in public health, we often talk about the environment and what's around us. And so I really encourage all of us to think about how to make the healthy choice the easy choice, and less blaming the individual for not being educated enough, for making that wrong choice. People smoke because it's in their face everywhere, and most people who smoke want to quit. So it's on us here at the Department of Public Health to make it easier to make that healthy choice, and that's how we want neighbors to be thinking about their community, their neighborhood as well, and hold us accountable to make it a healthier place to be.
Well, Dr. Margolius, thank you for joining us. Congratulations on the new legislation that's been passed, and we'll talk to you again soon.
Thanks so much.
And next, we'll visit the Center for Community Solutions to talk about services offered to our community in order to improve public health, social, and economic conditions throughout Cleveland. Stay with us. National Public Health Week is observed during the month of April. It's a time to spotlight organizations and individuals working every day to improve health outcomes and address disparities across our communities. Here in Cleveland, collaboration is key to creating real, lasting change. From data analysis to direct care, Cleveland's public health leaders are linking arms to tackle the root causes of health inequity and to empower communities along the way.
The Center for Community Solutions is a nonprofit, nonpartisan think tank, and we focus on providing solutions on health, economic, and social conditions through our policy analysis, communications, advocacies, and research.
That research often serves as the backbone for real-world policy change, helping both government and nonprofit leaders shape responsive, equity-driven programs.
We will collaborate with people from the government or people from different nonprofit organizations if they need help with filling out a project such as a community health needs assessment. We have done that before.
Whether it's a clinic helping a patient manage diabetes or an advocacy group fighting for clean air and smoke-free neighborhoods, public health is more than just medicine. It's data, education, and policy working together to help people live longer, healthier lives.
Centers for Community Solutions is a great partner of ours as it relates to providing us population health data that informs the work that we do at Neighborhood Family Practice.
At Neighborhood Family Practice, those insights are used to guide everything from marketing to care coordination, and especially in combating chronic diseases.
So if there's things that we're working on internally as far as meeting metrics, healthcare metrics, but anything related to chronic disease prevention or treatment.
But both experts agree, good data is just not enough. To make real progress, Cleveland must confront deeper social issues.
If we can work on social determinants of health, those type of things, they are the root causes of many of these health issues. And if we resolve them, then we can make sure that our citizens have the resources to thrive in their health.
You have the housing, you have education, your abilities to walk down the street, ride a bike, your ability to dream. So it's a lot that goes into an individual's ability to live well and live well throughout their lifespan.
To bridge those gaps, the call to action is clear. Work together and listen.
I think the main thing that we can do as a collective within the public health system is to break out of our silos and not work as individual organizations. I'm not telling them how I think we should solve their problems or the problems that we think they have, but actually listen to what their issues are, what their needs are, and include them in the solution process.
This National Public Health Week, Cleveland's message is simple. Health equity starts with partnership, policy, and people working together to build stronger, healthier communities. If you'd like more information about community health research and policy advocacy, you can visit communitysolutions.com. Next, we sat down with Dr. Randy Vince, Director of Minority Men's Health at the Cutler Center for Men at University Hospitals. He emphasized the importance of addressing men's health. We also stopped by Murtis Taylor Human Services Center, where their recent event put a spotlight on raising awareness around community health topics. Stay tuned. It's all happening right here on TV 20.
Are you tired of that hard to start, hard to push gasoline-powered lawnmower? Have you been thinking about going electric? The Cleveland Department of Public Health, Division of Air Quality, is happy to offer an exciting opportunity to make it easier for Cuyahoga County residents to make the switch. We are pleased to announce our electric lawnmower rebate program. Cuyahoga County residents can receive a $100 Visa rebate gift card after purchasing a battery-operated electric lawnmower. Here's how. First, register online with Cleveland Division of Air Quality or by calling the 24/7 hotline. Then, you must scrap your gasoline-powered lawnmower and obtain proof that a gasoline-powered lawnmower was scrapped. Purchase your electric lawnmower from any retail store or online. The lawnmower you purchase can be any brand, but it must be new and it must be cordless. Submit proof to the Cleveland Division of Air Quality. Then, pick up your $100 Visa rebate gift card from one of CDAQ's designated pickup locations. Limited rebates available. Register today so you don't miss your chance. Additional restrictions apply. Visit our website for details.
Hello, I'm Michelle Princeton, and I'm a licensed social worker working for the Social Support Service Unit out of the Mayor's Office of Prevention Intervention Opportunities for Youth and Young Adults. The City of Cleveland has demonstrated a long-term commitment to residents working to create safe spaces in our neighborhood resource and recreation centers where families can access free resources and support services. We are committed to working together with families and other community providers to identify and help families who are struggling to achieve a better quality of life. To access the social support services, leave a message at 216-664-2223 and a team member will return your call. Our work includes referring individuals to appropriate services such as medical, hospital-related, long-term counseling, public assistance, veterans benefits, Social Security, Medicare, Medicaid, food stamps, housing assistance, Head Start, and student loans. We also provide support and guidance for youth and young adults in addressing stigmatization, scapegoating, labeling, bullying, substance abuse, and unhealthy relationships. Once again, to access social support services, leave a message at 216-664-2223 and a team member will return your call. Thank you.
Welcome back to Cleveland Health on TV 20. I'm Richard Stewart. Thanks for sticking with us. We're shining a light on Minority Health Awareness Month and taking a closer look at the health issues that disproportionately affect communities of color. Dr. Randy Vince, a urologic oncologist at University Hospitals, serves as the Director of Minority Men's Health at the UH Center for Men. In this role, he is dedicated to addressing health disparities affecting men of color, particularly in areas such as cancers of the prostate, bladder, and kidney. Dr. Vince emphasizes the importance of encouraging preventive care and early screenings. His commitment to health equity stems from a desire to empower men to take control of their health, ultimately aiming to improve outcomes and save lives.
As it relates to minority men, the things that we often talk about are the fact that there's a higher prevalence of chronic conditions like high blood pressure and diabetes. You often have these men who are undiagnosed or undertreated for mental health conditions. You know, minority men are also less likely to be properly insured.
Dr. Vince also points out the key differences between minority health and the health of the general population, disparities that underscore the need for targeted outreach, education, and community-based solutions to ensure equitable health care.
One of the major things that we often think about or often fail to think about is, where you live highly influences so many different things. And so we know that minority men are more likely to live in poverty than the general population. Financial security or stability impacts where you live. That impacts your pollution exposure, your foods, also can impact your mental health, which can influence behaviors like drinking and smoking, also influences your ability to access preventative health care services.
Cultural misunderstandings can also prevent men from obtaining the health care they need.
Those misconceptions and stigmas are even heightened sometimes in the minority men community, and this is for several reasons. I think one is it has been historically thought of as weak for a man to talk about his health care and his health experiences or the challenges that he's dealing with when it comes to his health.
Improving outreach towards men from diverse backgrounds is essential, and in doing so, it's important for providers to meet them where they are, in their own communities. Services like nutrition programs and preventative care can go a long way towards improving outcomes.
A Black surgeon, it truly means a lot to me, but I do think it allows me to build bridges where they previously weren't built, because a lot of times what we'll see is you have these major health institutions that are in a city, and if you step 4 or 5 blocks off of that campus of that health institution, you see some of the most alarming disparities, whether we're talking about financial security or access to nutritious food, access to care, whatever it may be. And because I've lived in those types of communities, and now I'm also working in a major health institution, it's like now we can start to build those relationships and bridge the gap.
For more information about minority men's health at the UH Cutler Center for Men, you can visit uhhospitals.org. In Cleveland, a community-driven health initiative is making strides in addressing chronic illnesses and promoting healthier lifestyles in communities of color. Thriving Together is more than just a health fair, it's a movement for change. In the heart of Cleveland, health and hope are on full display. Thriving Together, an annual health event at Murtis Taylor Human Services System, is back, bringing screenings, education, and empowerment directly to this East Side community.
Thriving Together came to be because we wanted to close the gap on the disparities that are being faced in minority health communities.
This year's focus, diabetes, a disease that disproportionately impacts African American and Latino populations.
This year we're focusing on diabetes in hopes that we can educate individuals, promote prevention, because there's so many people in our communities who are not aware that they're at risk for diabetes.
Today is much more than just a health fair. It's a lifeline for many. Clevelanders are receiving free health screenings of all kinds, and they're all tailored to reduce the disparities that exist, particularly in communities of color.
This will lead to a healthier lifestyle, early screenings, and that individuals will be stronger.
For organizers, the event is about more than healthcare. It's about changing habits, personal growth, and supporting families.
I definitely want us to move away from just surviving to truly striving.
That vision is shared by co-organizer Alfre Hudson, whose own story of overcoming adversity fuels her passion for service.
I actually grew up homeless. I grew up at the Salvation Army in the city of Chicago, and I remember distinctly someone came and helped my family. And because of that, they truly made an impact in my life.
From health screenings to fitness demos, organizers stress that simple movement is a great place to start.
A lot of focus is on exercise. So each year we have an exercise exhibition. So it's either an exercise exhibition that incorporates a different style of being active, such as line dancing, such as tap dance, or such as a yoga or a Tai Chi.
The message is clear. Healthy living can be fun, accessible, and shared.
We do chair exercises here, which is like aerobics, and also Tai Chi during the week, and we do line dancing on Fridays. I think it's important for us to try to improve our eating habits and try to improve our nutritional aspects of our diet, and to try to cook foods that are more nutritional. I'm thinking about putting more beets in my salad, as a matter of fact, and a lot more different vegetables that I didn't normally eat.
I hope that families walk away knowing that they are empowered. I hope that when they walk away, they know that this health journey is not something that they're on alone, and that we are better thriving together.
With heart, healing, and a strong sense of community, Thriving Together is helping Cleveland take a step forward toward equity, awareness, and better health for everyone. Coming up next on Cleveland Health on TV 20, how clean is the air in your home? Yvette Mitchell breaks down the Clean in CLE push for healthier spaces, plus vital information on Black maternal health. You won't want to miss this. Please stay with us.
Hello, I'm Scott Osicki, Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. We know that life can be overwhelming, but you don't have to face it alone. If you or someone you know is feeling anxious, depressed, in a mental health crisis, have alcohol or other drug use concerns, or just need someone to talk to, help is available. Call or text 988, the Suicide and Crisis Lifeline. It's free, confidential, and available every day 24/7. Trained and caring counselors are there to listen, support, and help you find hope no matter what you're going through. Remember, you're not alone. Call or text 988 anytime, because your mental health matters, and so do you.
At Cleveland Rape Crisis Center, we believe that everyone deserves to feel safe, supported, and heard. For over 50 years, we have been here to help survivors of rape, sexual abuse, and human trafficking rebuild their lives and to prevent future violence through education and advocacy. Our services are confidential and always free of charge. We provide 24/7 crisis and support hotline for immediate help, individual and group counseling to promote healing, specialized services for children and families, advocacy and legal support to navigate complex systems, prevention education to empower communities, resources and support for deaf and hard of hearing survivors through our Deaf Pathways program, and drop-in center for the on-spot assistance. No matter what you're going through, you are not alone. Call our 24/7 hotline at 216-619-6192 or text 216-619-6192 or visit clevelandrapecrisis.org to chat with a trained professional. Help is here and healing is possible. Together, we can make a difference.
Welcome back to Cleveland Health on TV 20. Today, we're taking some time to speak about National Healthy Homes Month. And joining us to do that is Environmental Program Manager for the Cleveland Division of Air Quality, Yvette Mitchell. That's a mouthful.
Yes.
Thanks for joining us, Yvette.
Thank you for having us.
So, talk about National Healthy Homes Month and how that aligns with the work you're doing over at the Cleveland Department of Public Health with regard to Clean and CLE.
Okay. So yes, National Healthy Homes Month is a time for us to pause and let both homeowners and renters know about the indoor air quality hazards as well as safety hazards that could exist in their home. Our director Margolius, often says housing is health. And so we want you to know that if you keep your house healthy, the housing and health of the occupants could also be healthier. How it ties in with the work of the Clean and CLE, which is our expanded air sensor network program, is that we often say place matters. Where you live matters. Where your zip code is can determine your quality of life. And so by placing these sensors in these neighborhoods that have been historically ignored over the years or have higher incident rates of chronic conditions, including asthma, what we're doing is bringing awareness to that and finding out what's in the air. So we want you to know that what happens outdoors, though, can impact what happens inside your home.
And what are some of the most common indoor air quality issues that Clevelanders face today, particularly in light of the fact that the homes many of them are so old?
So some foundational things could exist, such as cracks and crevices in the surfaces, which could lead to the intrusion of vapors that include radon going into the home. It could also include the use of combustion fuel appliances, such as gas stoves, kerosene lamps and stoves, as well as your water heater or even your furnace. Also, we talk about mold, lead, dust mites, pests. If you use certain types of contaminants, all those things can impact the quality of your indoor air.
And the Center for Community Solutions, well, not Center for Community Solutions, Community Housing Solutions,
yes,
is assisting in this effort. What is their role and how are they helping?
So in 2024, US EPA, which is the Environmental Protection Agency, offered a grant for $18 million to replace gas stoves in families' homes. The caveat is that one resident in the home has to have asthma, and what they're looking to do is test your indoor air quality initially to see what is the baseline of indoor air quality in the house, and then they're going to remove your gas stove and replace it with an electric stove. And then they're also going to then afterwards come back in and do air quality testing a second time. So their role is to find residents in the community who qualify to participate and get these stoves out, because people don't really recognize that gas stoves can contribute to poor indoor air quality.
Well, Yvette, that seems like very valuable information to share with our viewers during National Healthy Homes Month, so thank you.
Thank you.
Now we shift our focus to Black maternal health awareness, an issue that remains critical here in the city of Cleveland. We're going to highlight the stark disparities in outcomes between Black women and other racial groups. We're committed to driving change. Here are a few statistics. National campaigns such as Black Maternal Health Week create dialogue advocating for Black maternal health, rights, and justice. The movement was founded by the Black Mamas Matter Alliance and has become a vital annual observance in public health and policy spaces. Black women in the United States are 3 times more likely to die from pregnancy-related complications than white women due to systemic racism, inequalities in healthcare, and social determinants of health. Mental health challenges are often overlooked in maternal care, yet Black mothers face higher risks of postpartum depression and less access to support. Lack of access to quality prenatal and postmortem care significantly contributes to the poor outcomes for Black mothers and their babies. Getting involved can be as simple as attending an event, sharing information online, or contacting your local representatives, telling them to support maternal health equity policies. Organizations nationwide work year-round to support Black birthing persons through midwifery care, doulas, education, and advocacy. Join us in continuing to shine a light on Black maternal health. That concludes this edition of Cleveland Health. Thank you for watching. We hope you learned something that could help you or a loved one live a healthier life. I'm your host, Richard Stewart. Thanks again for joining us.